Hello, my name is Krista Williams. I'm a registered nurse and a student at William Carey University. The purpose of my project is to promote healthy sleep habits in older adults. It is important to assess older adults for sleep problems because poor sleep increases the risk for fatigue. It puts them at risk for falls, which could lead to health complications that could also result in mortality. The goal is for older adults to maintain an optimal state of alertness while awake and also achieve quality sleep during preferred sleeping hours. Daytime sleepiness may also be an indicator that hypertension and diabetes are uncontrolled. Daytime sleepiness is not only a symptom of sleep disorders, but also result in decreased in health and functional outcomes in the older adults. Excessive sleepiness may be caused by difficulty initiating sleep, impaired sleep maintenance, and waking prematurely. Sleep disturbances in the older adult may also be associated with undertreated pain. There are many sleep disorders in which excessive sleepiness is a common symptom. The most common reported by older adults are obstructive sleep apnea, insomnia, and restless leg syndrome. Many sleep disorders are characterized by excessive sleepiness and go untreated because healthcare professionals are uninformed on this condition and the many effective treatments that are available. Sleep apnea increases the risk for nocturia, which is increased urination at night, hypertension, and cardiovascular disease. Treatment normally includes wearing a mask during sleeping called a CPAP. Management of diagnoses that lead to sleep disturbances is very important to achieve optimal health outcomes in older adults. Medication regimens for restless leg syndrome, insomnia, and depression must be adhered to. CPAP machines should be checked for proper fitting. Respiratory tags and other resources are available to ensure a proper, comfortable fit. Keeping a diary of nap times, sleeping hours, and awake times can also aid in treatment. If obesity is a problem, weight loss and increase in activity is also a good intervention. Today, I will be performing a sleep assessment on Mrs. Lula Mae Tollison. Can you state your name and age for me?
Yes. My name is Lula Tollison, and I'm 73 years old.
Do you consent to participating in this sleep assessment today, Ms. Tollison?
Yes, I do.
Is your vision adequate with your glasses?
Yeah.
Can you see efficiently enough to drive?
Yes.
Do you wear hearing aids?
No.
Can you hear and understand me well?
Yes.
Do you take naps or feel sleepy a lot during daytime hours?
No.
If a client reports excessive daytime sleepiness, a complete sleep assessment should be completed. Are you experiencing any pain today, Ms. Tollison?
No, I'm not.
Do you have any pain on a regular basis? Do you take any pain medications?
Well, every so often, because I do have some, they said sciatic nerve.
Pain?
Yeah. That's in my knee and the lower part of my back, but it's not all the time.
But it's not preventing you from getting adequate amount of sleep at night?
No.
Has the recent loss of your husband affected your sleep in any way?
Well, at first, but I'm getting better with it now. I guess simply because he wasn't there and it just didn't seem right. But I'm getting a little bit more used to, him not being there.
Have you ever experienced any uncomfortable or creeping, crawling sensations in your legs during sleep at night that's only relieved when you move your legs?
Mm-mm.
Has anyone ever told you that you snore while sleeping?
Well, a long time back, my husband said I did. So
How did he describe that?
it was just making a noise. Because when he said I snored, that was the end of it. Because I thought I didn't, but he said I did. So evidently he was awake. He knew I didn't.
Do you have any problems with nasal or chest congestion?
No.
Have you ever had a sleep study performed?
Yes.
Do you remember what the results of your sleep study was?
They told me something, but I don't remember. Evidently it wasn't like it should be, because I have that thing that I have to put on every night when I get ready to go to sleep.
Next, we'll be using the Epworth Sleepiness Scale tool, and it is an effective instrument that is used to measure average daytime sleepiness. Ask you a few questions, Ms. Tollison. And 0 would be would never doze. 1 would be slight chance of dozing. 2 would be moderate chance of dozing. And 3 would be high chance of dozing. So 0 would be the least amount of sleeping. 3 would be a high chance of dozing off. When you are sitting and reading, what's the chance of you falling asleep?
If I'm sitting reading,
And 0 would be never doze. 1 slightly. 2 moderate. 3 high.
if I'm reading, 0.
Okay. What about watching television?
And that all depends on like the picture. If it's not what I'm interested in, that would easily be maybe like a 2.
What about sitting inactive in a public place like a theater or a meeting?
No. 0.
As a passenger in a car for an hour without a break. I know y'all recently traveled to Chicago, so
Yeah. That would be, if it's for an hour, no longer than an hour. No, 0.
lying down to rest in the afternoon when circumstances permit.
That means if I'm laying down, there's a chance of me dozing. If I lay down and stay there for, you can put that at a 3 maybe. I most definitely would go on to sleep if I lay down.
Sitting and talking to someone.
That depends on who I'm talking to. If it's somebody boring, rate that as a 2.
Okay. Sitting quietly after a lunch without alcohol.
Sitting quietly after lunch, quietly, that's a 2.
In a car while stopped for a few minutes in traffic.
0.
Your total came out to be a 9, and normally that would mean that you would need to seek medical advice because you are very sleepy. But you've already sought medical advice because you've had a sleep study done and you wear your CPAP every night, correct?
Exactly.
Okay, and how many hours of sleep do you get at night?
About average about 6 or 7.
Okay, and I think that's pretty good. Some things that you can do is just continue to increase your activity, like continue to go out and eat with your sister and go and visit friends during the daytime, or maybe go for a walk, and make sure that you wear your CPAP every night, and also make sure that you're managing your diabetes well too. Is your blood sugars and everything running okay?
Yeah.
I think you do everything well as far as your sleep habits. Just like I said, make sure that you continue with lifestyle changes, increasing your activity during the day, going for a walk if you feel like it, and just managing your blood pressure and your diabetes and eating a good healthy diet.
Okay.
Thank you for letting me do this assessment on you, Miss Tolleson.
You're so welcome. So welcome.
Tell me a little bit about your CPAP machine. Do you wear it every night?
Yes, I do.
And how do you apply that?
Okay. I push this button here and turn it on, and when the air start coming up, then I place this like this.
Now, does it fit comfortable?
Yes,
Okay, and do you feel like you get a better night's rest when you wear your CPAP at night?
I do.
Okay.
I do.